Menopause is a natural phase in every woman's life, but it comes with a range of symptoms that can be quite challenging. So, whether you're experiencing hot flashes, mood swings, or sleep disturbances, there are various treatments available that can help. Family physicians, however, play a crucial role in educating patients about menopause, its symptoms, and treatment options. They provide support and guidance, helping women make informed decisions about their health and well-being during this transition. Today on our podcast, we will be exploring with a family physician some of the most effective options in the treatment of menopause. So don't go away, stay tuned. Welcome to the Help We Need podcast, where we explore topics that empower women and support their well-being. I'm your host, Fumike Murunkeji. Today, again, we will be going a step further on the topic of menopause to discuss the symptoms and possible treatment options that women can adopt during varying aspects of their menopausal journey. And on today's episode, we have a very special guest joining us today to help us dissect this topic a bit more. Dr. Tayo Adewumi is a family physician with over 16 years of experience. Dr. Tayo is a general practitioner with significant practicing experience in the United Kingdom and in Qatar. Thank you, Dr. Tayo, for joining us today to discuss the symptoms and treatment options for women undergoing menopausal changes.
Thank you very much for having me.
Absolutely. And thank you so much for joining us. I know you are very busy, but like you said, anything for the women. And I'm sure our listeners will get to learn a lot as we tackle the main issues associated with the symptoms of menopause and possible treatment options available to us as women. Okay, so first I would like our audience to get to know you a bit more. So we're going to break the ice a bit. So can you share with us some information about yourself and why you decided to become a doctor?
Right. I know it might sound like a cliche, but I've always wanted to be a doctor. I always wanted to do medicine right from when I was about 6 or 7. I wanted to be a pediatrician, to be specific, and I got the opportunity to work as a pediatrician for a few years. But because it wasn't having an impact on work-life balance, I took a career break and went back to retrain as a family physician, and I've been practicing as a family physician for over 16 years. And wow. Yes, and also not just to say that menopause is a topic that I am particularly passionate about. I am passionate about women's health. So menopause obviously is a significant and important aspect of women's health. And also on a personal note, I am in that age bracket of being in menopause. So it's important on a professional and on a personal note as well.
Well, thank you for sharing. I think I'm in the same boat. So in as much as we're also empowering women, I think we're doing some good service as well, empowering ourselves. So thank you so much for sharing about your practice, and I would say your tenacity as well. You were gearing to be a pediatrician, and then you stopped, and then you decided you wanted to be a family physician. So I think that's very notable. But thank you so much for sharing that with us. So let's get the conversation rolling. I'm sure our ladies are excited to have us move on. So from a family physician perspective, and again, we've used the word family physician, we've used the word, a general practitioner, if I'm not mistaken, which is mostly referred to as a GP. You might want to break that up a bit and explain to our women. But anyway, I'm just trying to understand from your perspective as a doctor, how would you define menopause? And what are the common symptoms of menopause that women that come to the clinic or the hospitals present to you as a family physician doctor?
Thank you very much. A family physician doctor is the same as a general practitioner. So that, like you rightly said, we have a knowledge about many things, and obviously we're able to that we're the first port of call when a patient has a problem. But when needed, we might need to refer you on to a specialist. But going straight on to our topic, menopause. I'll define it first. So menopause is a natural occurrence in every woman's life. It's meno just means monthly, pause means stop. It's a period that marks the end of our fertility. It's a period that marks the end of a monthly cycle. But also, you can't say a woman is in menopause until she's had 12 consecutive months of not having any period. The average age of occurrence is, well, the range is from 45 to 55, but also by 54, age 54, 80% of women would have gone through menopause. Before we talk about the symptoms, I'll talk about the different stages. So you have perimenopause, you have menopause, and postmenopause. Perimenopause is the years leading into menopause, where you have fluctuation in the hormone levels, irregular period, and then also some symptoms of menopause develop. Menopause is when a woman has had 12 consecutive months of not having a period, then you can say she's in menopause. And after that period is postmenopause. But it's important to note that all those symptoms can occur at any stage. Perimenopause, menopause, and postmenopause is not excluded to a particular period in a woman's menopause journey, if I can say that. And with regards to the symptoms, you can divide the symptoms broadly into two categories, physical and emotional and mental. We'll go into the emotional and mental one a little bit further later on. But the physical symptoms, they have been reported that there are over, including physical and emotional, 35 symptoms that a woman can experience. But the common physical ones are hot flushes. This is that when a woman has a sudden feeling of warmth rising up, it affects the upper part of the body, the shoulder, the neck, the face. Some women actually flush, that their face goes red with it. Other common ones are night sweats. So night sweats are like hot flushes that occur in the night. And also sometimes the women feel soaked and drenched in sweat. Other common symptoms are vaginal dryness, because estrogen, which is one of the hormones that is significantly depleted in menopause, helps us to maintain normal, healthy skin. So it can cause dryness in the vaginal area, women presenting with discomfort, pain during intercourse, and some women are prone to recurrent urinary tract infection. Other symptoms the other physical symptoms are poor sleep, other palpitations, headaches, migraines, and joint aches and pain, dry skin, and also there's an increased risk of osteoporosis, which occurs with menopause. So those are the common physical symptoms that women present with. And like I said, and another one also that is common, I forgot to mention, sorry, is weight gain, especially around the waist, because usually with menopause, there's a reduction in our rate of metabolism. So it's much easier for us to put on weight, especially around the waist area. Yeah.
You said 35 symptoms. So
Yeah.
we're just talking about maybe the ones that majorly are presented to you at the clinic. So there could be more. That's
Yes.
interesting.
Yeah.
I've had some friends talk about symptoms also, such as thinning of the ear, and
Yes.
you
Yeah,
talked
right.
about dry skin as well, more
Yeah.
in terms of their hair. It's thinning out.
Yes.
So
Yeah.
obviously that's probably one symptom as well. But just to come to that understanding that we have 35,
Yes.
um,
Yes.
that's a lot. So thank you so much for sharing and providing us those perspectives. I think it's helpful, right? Because you rightly said that it's a journey. So just helping us tailor it out to say the perimenopause, the menopause, and the post-menopause stages are the journey that women have or they undergo when they go through menopause. And I think it's helpful for you to call that out because every woman on the call may be on one particular spectrum or the other. And another thing I think was helpful that you spoke to was that regardless of the journey or the stages we're at, those symptoms still present themselves. So I would normally think that when a woman is menopausal, that's when the symptoms start to present itself. So if I'm not mistaken, you were saying no. Even from the getting ready for the body's getting ready to get into that state, the symptoms start to present themselves. So I think that's, wow, that's very interesting to note. So I think our women would obviously take that as important points to reflect on. So they don't have to necessarily stop the menstrual cycle before they go ahead to maybe see a doctor or have a doctor support them with their symptoms. So that's very helpful. Thank you so much for sharing.
You're welcome.
So so you talked about from a doctor's perspective, right? When the patients come to see you in the clinic. So I'm just wondering from that perspective, from your perspective, when a patient comes to see you, how do you manage the treatment of menopausal symptoms? I mean, they obviously will come with a symptom, but how would you know that they're in menopause? Or if you could just walk us through helping us understand that maybe not just the fact that they're within that age bracket, I don't know, but how are you able to manage their treatment when they present symptoms to you, maybe at the hospital?
Yes, thank you. Before I talk about answer that question, I forgot to say that even though you not every woman would have symptoms of that age group that we talked about, only 75% of women would have menopausal symptoms. So 25% of women will go through the menopause, perimenopause without any symptoms. And out of the 75 that have symptoms, 25% of them would have significant symptoms that impact their life. But going on to answer the question, the first thing is when a woman presents is you need to take a detailed history. Obviously, like you said, what is her age group? What has she come with? What are her symptoms? Is she still having her period? When was the last time she had her period? What symptoms is she experiencing? Also, you want to know the impact these symptoms are having on her day-to-day life, how it's affecting her productivity and her quality of life. But also, it's important to note that there are other things that could present like menopause symptoms, like hot flushes, night sweats, that are not necessarily menopause. So you need to do a risk assessment. You need to rule out red flags. And if you are in doubt, you could do certain blood tests. We don't need to do a blood test to confirm a woman is in menopause once she's from the age 45 to 55, and from the history where can almost confidently say she's in menopause, but we might need to do some blood tests to rule out other things. But if we've come to that conclusion from our assessment, from our history taking, from investigation, if needed, that this woman is in menopause, then we need to find out how best to manage her. Like I said, some women don't have their symptoms are manageable. They can manage, and it is not having an impact on their day-to-day life. But irrespective whether you're having symptoms that are impactful or not impactful on the quality of life, one thing that is important is lifestyle. Your lifestyle is important. And the previous presenter you had a few weeks ago gave a good information with regards to nutrition and menopause. So that's important. So it's effectively educating your patients, giving them the options of management, and then helping them to choose what is best for them, because it's not one size that fits all. And also, you want to help your patients to make give them good information to help them make the right decision that suits them. So if we're talking about management in terms of medication, you have hormonal management, hormonal medication and non-hormonal medication. But also part of your assessment is risk assessment. You want to know, again, what a woman's personal medical history is, any personal history of breast cancer, any personal history of high blood pressure, any personal family history of stroke. So all this is important to in your process of assessing the woman. And then, like I said, there are different managements, hormonal, non-hormonal, but the most also irrespective, like I said earlier, things like it sounds like I'm repeating myself, that lifestyle is important, your diet, your exercise, managing stress, managing sleep, a good social connectedness. And it's these are part of the important steps in managing a woman with menopause. So if also there are other specific symptoms that women can present with that can also be managed in a more direct way, so like vaginal dryness. Not every woman that presents with the vaginal dryness needs tablets or needs hormonal treatment, the non-hormonal treatment that we'll talk about later. So I think basically that's just the way, taking a good history, assessing the woman, assessing the risk, and just knowing and deciding along with that woman what suits her best. So whatever you decide, obviously, you need to bring this patient back for follow-up, because you want to find out whatever mode of management they have chosen, is it working? Is it making a difference? Do you need to be making adjustments here and there? Or even if the symptoms are getting worse, is it something that we now need to refer to, or if they're presenting with new symptoms and that we can't manage in primary care, do we need to be referring them to a gynecologist or to a supportive management from like the mental health team? So it's working with the woman and just deciding on what is best and taking it one step and a day at a time.
Well, thank you. That's very enlightening in terms of the journey of care that you provide. Something just came to mind, and yes, you rightly said so. We did have an episode earlier on where we approached the topic from a nutritional standpoint, and helping women understand that their food choices was also helpful in helping alleviate the symptoms. And one of the reasons we brought you on our podcast today is really to zoom in on the symptoms and try and help us unpack that a bit. And I'm just wondering, because we are women across different geographies across the world, when women are presented with menopausal symptoms, is there any particular doctor that they need to see? Because we started off with saying when you come to the hospital, or is there a specific doctor that they really need to see when they're sensing, I'm on this menopausal journey and I really need to address the symptoms? So just as an afterthought, I'm thinking through that now. So maybe your guidance around that might be helpful to note.
Yeah, most family doctors, most family physicians or general practitioners should be able to manage a woman who is presenting with menopausal symptoms. So the first port of call will be your general practitioner, your family physician. And if need be, then you might need to be referred to a gynecologist who has a special interest in that field. But for most majority of women, a family physician or a general practitioner should be able to manage the woman in her journey of menopause as best as possible. So the first port of call will be a family physician, but if need be, refer to a gynecologist for specialized management.
Thank you. I think that's helpful. And again, women, as you're listening, we're using the word family physician and GP or general practitioner interchangeably. They mean the same thing. So what I can hear from what you're saying now is women should feel comfortable to go to the hospital and present these symptoms to their doctor, to a GP or a family physician. The doctor is able to address that and provide the needed support, as you mentioned earlier. So I think it's comforting to know that you're taking a full picture to create support for our women. because some of our women may obviously, depending on the symptoms that they're experiencing, might be uncomfortable and might be somewhat concerned, right? So I think it gives us some ease to know that the doctor's role really is to assess you as a person. They check your personal history, like you've said. They look at your risk assessment if you're going through other treatments to see maybe that's really the reason for those symptoms, and not necessarily jump into conclusion that it is menopausal symptoms. And you said if need be, a blood test could be conducted, but not necessarily required. But again, depending on case-to-case situations, that could be recommended. You've also talked about the treatment options, which could be hormonal and non-hormonal. I believe we'll get to that much later in our conversations. And you spoke about lifestyle management. So again, we're piggybacking on the previous podcast where we talked about how nutrition and exercise, hydration can help us manage those symptoms as well. And then you talked about monitoring and adjusting. So it's not just to give the dosage or give the drugs or whatever treatment is needed, but to continuously monitor and just ensure that you're adjusting and adapting as necessary. I like the part where you talked about, I would say, the multidisciplinary approach, where you decide, if this case is presenting itself in a way that maybe a specialist will be required, I can then, recommend them to either go and see, for example, a gynecologist or what other type of doctor would be able to support in that regard. So I think this is comforting for us women as we listen to you to note that the doctor helps us walk through our full journey. While they may not necessarily be the ones that may complete that journey with us, they would definitely guide us to whomever within the practice they feel would be much more appropriate to support us with whatever symptoms that we are presenting. So I think that's really helpful. Now I'm going to speak to, because earlier on we were talking, you talked about the physical symptoms, and you also mentioned emotional and psychological symptoms as well. So here is where I'm keen to understand, what are the emotional and psychological symptoms in your practice that are typical in women that are undergoing menopause? And when I say typical, obviously, they present themselves as, emotional and psychological. What are those symptoms that you've been able to uncover or diagnose?
So some of these emotional, mental, or psychological symptoms women typically present with in menopause include mood swings. We just have moods fluctuating. You are happy one day, the next day you are sad, and the next day you are crying. They're now struggling with it. And obviously poor sleep. Poor sleep, if you don't sleep, it impacts your cognition. It impacts your ability to think right and think straight, but also low self-esteem. You begin to find women questioning themselves. But it's important to state that when you have this mental symptoms or psychological symptoms, for you to say that they are due to menopause, they don't happen in isolation. So that you would have them in combination with some physical symptoms. Also, it's worth noting that women who previously had mental or emotional symptoms can have the same level of emotional symptoms in menopause, or it could get a bit worse. And also women who've never had any emotional symptoms before could be presenting newly in menopause with emotional symptoms. But like I said, again, it's important to know that this emotional or psychological symptoms will not occur in isolation if they're caused by menopause. You would have to have one or two or a few physical symptoms along with them.
Well, thank you. Thank you so much for just expanding further on that. And I know when it comes to emotional and psychological symptoms, again, depending on where we are in the world, we have our cultural differences, and, most times there are connotations around having emotional or psychological symptoms, which women don't typically would like to be associated with. And sometimes women feel like they may think I'm losing it, I'm going crazy, I'm going mad. And I think it's comforting for women on the call to hear you say that when the symptoms do present themselves, first of all, the need to be self-aware, to understand that I've not been forgetting things. Now I'm forgetting things. And now understanding that it's more around the hormonal changes, right? It's not their fault. You're okay. You just need to explore the treatment options. First of all, check in at the hospital, to make the right diagnosis, which the doctors will do. And if we've had histories of psychological symptoms, whatever circumstance, whatever stage, whatever platform, I think it's helpful to seek help and not suffer alone, not keep it to ourselves and say, what will people think of me? I don't want people to hear about it. I think it's best that we understand, as you explained to us, that getting to a doctor as a first point of call is very, very important. We need to get to a doctor. We need to explain what we're going through. And the doctors will then ask for the questions, explore other options to just make sure that they're able to either connect it with menopausal changes or refer us to people that can support us with the best treatment options. And like you've rightly said, you've identified such symptoms as mood swings, anxiety and depression, memory problems, and poor sleep and low self-esteem. So I think this is helpful for our ladies listening in on the call, that if you're noticing that these are things that are creeping up now, I think the best point of call is, first of all, seek medical help. And from there, that journey would definitely become easier, as opposed to just trying to be strong and not doing anything about it, because it will get worse. So thank you so much for sharing. I think that's really helpful as we embark on this journey of menopause. So I'm coming to another question, and I noted earlier you talked about treatment options that could be hormonal or non-hormonal. So this is where I'm kind of I'm slowing down a bit, because I'm thinking this is more around a controversial question, at least to the best of my understanding. And specifically, it's with regards to hormone replacement therapy. And we refer to it as HRT. I mean, you're the best person to guide us further. But my question really is hormone replacement therapy, is it always the first option of treatment for women with symptoms of menopausal changes? And can you tell us more, right, about what are the benefits, what are the risks, what are the side effects that can be involved if women explore this option of treatment, so that we just unpack this more a bit and we kind of I won't say it's a myth, but really understand what HRT means, and if we need to demystify these thoughts or comments or going around on social media, what have you, you can guide us accordingly.
Thank you. So hormone replacement therapy, there's been, like you rightly said, a lot of controversies about it, but it's still the standardized, recognized care for women with menopausal symptoms. However, it's not everybody that will be happy to take it, and it's not conducive for everybody. And I think it also has to be that you educate your patients properly and just go through the risk and the benefits of whatever treatment options that a patient or a woman decides to go with. So hormone replacement therapy, there's the principle of prescribing hormone replacement therapy is just that if a woman has a womb, she needs estrogen and progesterone. Because the progesterone is needed to maintain the integrity of the lining of the womb. Whereas if a woman has had a hysterectomy, that means she's had her womb surgically removed, then the only hormone that she needs is estrogen. Estrogen, it comes in different preparations. It can be given as it comes as a tablet, it comes as a patch, it comes as a gel, a cream, or a spray. Progesterone always comes in combination with estrogen, except when you use the Mirena coil, which is a form of contraception, but it can be used as the progesterone component of HRT. So, in terms of the benefits of HRT, or hormone replacement therapy, it helps with hot flushes, it helps with night sweats, it helps with mood swings, it helps to maintain or reduce the risk of osteoporosis. So most of the symptoms of menopause can be managed with HRT. But now also, like we said, every medication has risk. So we need to, that's why we said earlier that we always have to make do a risk assessment. So one of the risks that people might be concerned about is with HRT is the risk with breast cancer. So it's actually the progesterone component of HRT that carries a little risk with breast cancer. But to put this into context, if you have 1,000 women from the ages of 50 to 60, 63 out of this 1,000 women will eventually at some point develop breast cancer without any exposure to HRT. That's because the risk of breast cancer increases with age. But now, if we now go down to the risk with HRT, if you expose this same number of women to HRT for, let's say, 7.5 years, that's the study that we normally work with, that we have this same number of women, the same age group exposed to HRT for 7.5 years, the increased number of women that would have breast cancer because they've been exposed to HRT is just 5. Now, there are other risk factors that are associated with breast cancer in this age group, 50 to 60. So let's take postmenopausal obesity. That individual situation carries an increased risk of making 10 more women to develop breast cancer. So whereas if you have women who have excess alcohol consumption, that individual risk increases the incidence of breast cancer also by between 8 to 11. So individual risk from lifestyle choices, lifestyle changes outweighs the risk of a woman getting breast cancer from HRT. So another risk that we talk about is blood clot or venous thromboembolism. Now, this risk has to do with the estrogen component of HRT, and it's only a slight risk. And I'll put it into context as well. The risk is higher in the first year of use. After the first year of using HRT, the risk is minimized or nullified. And the risk is higher with certain preparations, like the oral preparation of estrogen has that slightly increased risk. Whereas if you go with a patch, that risk, because the way the body metabolizes the medication delivered as a patch, that risk is minimized. But there are also other personal medical problems that increases the risk of a woman getting a blood clot from HRT. So that's if the woman has a personal or family history of blood clot, or if the woman is obese. Even obesity in itself carries an increased risk of blood clot. Now, also another risk that we talk about is the cardiovascular risk. And also, again, this has had a lot of controversy, but the summary is that if a woman uses HRT to manage her menopause symptoms early on in menopause, then the benefit she gets with HRT from the cardiovascular point of view outweighs the risk.
So thank you so much, Dr. Tayo, for helping us get to the nitty-gritty, just digging it a bit further to understand what are these symptoms we keep talking about, and more importantly, the effective options or treatment options that we as women can avail ourselves as we speak to our physicians, as we speak to our doctors, based on what works best for us. The explanations have been so helpful personally to me. I will definitely be listening in again to this podcast for my own well-being. So, Dr. Tayo, I've personally learned a lot. If I need to say that, I am saying that now. So thank you once again for sharing. And we're so grateful that you've decided to join us today to have this very crucial conversation.
Thank you. Thank you very much for having me. Thank you. You're doing a great job for me, Kay. Thank you.
Thank you for joining us and just helping us demystify all those myths and issues. And I think, like you said, we need a community. This is a community where women can lean in and empower not just themselves, but others. So, dear listeners, please feel free to share this podcast with your relatives, with your friends, with your loved ones as well. I mean, education is empowerment in itself. And please remember that the best treatment plan is one that is tailored to your individual needs and health profile, not what your friend said. Please always discuss your options. I think it is really helpful to call this out again and again. Always discuss your treatment options or whatever conditions you're going through with a healthcare provider or medical doctor to determine the most suitable approach for you. Thank you so much for tuning in to our podcast episode today. I hope it has been extremely helpful. Don't forget to subscribe, and please, once again, remember to share with your friends, your sisters, your daughters, your husbands, your sons, and even your fathers. Like I said, it makes the whole journey much easier when we do so. So keep listening to the Help We Need podcast. Stay tuned in for more episodes on living your best lives. And until next time, stay empowered and remember to empower her.